Obsessive-compulsive disorder, or OCD, is a disorder in which people have recurring unwanted thoughts, ideas, or sensations, which are called the obsessions, that make them feel driven to do something repeatedly, which are the compulsions, or attract from a specific situation or object. Why do you always have to be so OCD about everything? Is it that big of a deal to have all the papers folded the same way? This was my early interpretation of what OCD was, a way of telling people that they are being nitpicky with things in a neat freak joke. At the time, I noticed I would get extremely sensitive when it came to certain objects or situations, and my mother always used the OCD joke. I think over time we both noticed it was something more. When we visited my doctor, she gave me a test and later told me that I had moderate to severe OCD. Today, I would like to inform you about the symptoms and extent of OCD, who and how it affects others, and coping mechanisms used for the treatment. So what is OCD? OCD is a mental disorder that has many psychological and physical aspects and symptoms. According to the American Psychiatric Association, many people with OCD have difficulty in disengaging from their obsessive thoughts or compulsions so much that it disrupts their ability to do normal activities. Let's talk about its effects on the body. People with OCD have high levels of fear, distress, and nervousness that comes with the thought of not engaging in a compulsion. This can lead to severe panic attacks, head rushes, mood swings, dysmorphia, and even dissociation. OCD patients may also avoid leaving their house because the compulsions are so deep. Many tend to put themselves in a state of isolation with just them and their obsessions. There are two types of symptoms, which is external and internal symptoms of OCD. So the external symptoms may include constant checking, counting, washing of something, or arrangement of items. It can also be avoiding orders, rubbing, scratching, or saying a phrase multiple times or in a very specific order or manner. The internal symptoms of OCD include repeated unwanted ideas, fear of contamination, aggressive impulses, persistent sexual thoughts, and others. Sometimes it can get to a point where it is endangering to others or oneself, like images of hurting someone or something that is loved, thoughts of bodily harm to you or others, and thoughts of endangerment to yourself. Now that you know it can affect your body mentally and physically, let's take a look at how widespread it really is. So, according to the National OCD Foundation, an estimation of about 1 in 100 adults, or between 2 to 3 million adults in the United States, currently have OCD. This is roughly the same number of people living in the city of Houston, Texas. According to the World Health Organization, it is considered the fourth most common psychiatric condition, ranking after phobias, substance abuse disorders, and major depressive mood disorder. Some groups may be more susceptible to OCD than others, so the risk factors can include family history, gender, and age. Dr. Daniel B. Block, author of the chapter DBSA, Depression Bipolar Support Alliance, in the book New Directions, says 50% of your risk developing OCD is dependent on your genes and family history. Gender is a risk factor for developing OCD, as boys are more likely than girls, and OCD is also more likely to be developed in the child or teenage years for both genders. Given the extent and prevalence of OCD, I'm sure the question stands, how do you cope or treat it? There are two common options for OCD treatment. So the first one is medication. Certain psychiatric medications can help control the obsessions and compulsions of OCD. Antidepressants like clomipirene, fluoxetine, and sertraline are commonly used to calm the mind into a state of control for a short period of time. The medicine used is a class of medications called the serotonin reuptake inhibitors, or SRIs. This will slow down the serotonin levels and help the body become more regulated. The second option is cognitive behavior therapy or exposure therapy. Exposure therapy is a behavioral therapy that gradually exposes people to situations designed to provoke a person's obsessions in a safe environment. This provides a patient with coping skills for when a triggering situation presents itself, allowing them to use the skills to prevent their compulsion from taking over. It is the most effective type of therapy for OCD. As we have seen, OCD is widespread and can affect anyone. Fortunately, there are two options for treatment to help cope and even cure OCD. Personally, I think the combination of medication while in exposure therapy is the best option for me and has been very beneficial. OCD takes time to treat and understand and is unique to each person. It is not a process to rush nor be ashamed of. I am glad that I can understand my OCD and know what is helpful. And here are my works cited.